If you ever wondered at any point what a stroke was, let's talk about it today. And many of you identify strokes by seeing a person who's failing to move one side of the body. Some people have their face moving towards one side, like the mouth is sort of bent. Now, what really is a stroke? Simply put, a stroke is when blood fails to reach certain parts of your brain. Now, let's simplify it. Your brain is tissue, just like many other organs in your body, and it requires blood. And for blood to go there, there's obviously a channel, and these are your blood vessels. Now, these blood vessels taking blood to that point can be interrupted by two things, and these make the types of strokes. Number one, it can be blocked. So the blood vessel can be blocked by a variety of things. It can be your blood which has clotted. It can be something that we call a plaque, that is reducing the amount of space that your blood vessel is supposed to be using to transmit the blood, very common in hypertension. Now, this one is called an ischemic stroke, meaning ischemia is literally preventing blood from going to a place where it's supposed to go. So that whole process of ischemia is called an ischemic stroke. So that's type number one. And number two is when the blood vessel that's supplying a certain part of the brain bursts. So it bursts open. Instead of the blood going where it's supposed to go, it starts going elsewhere. So these are patients who are bleeding in their brain. Majority of the times, many times, over 85%, majority of the strokes that we get to see are ischemic strokes where blood has been blocked. And in our setup, the most common cause is hypertension. And here's the interesting part. When we medical doctors tell you that the stroke is on the left side, what you, the patient, is going to see is that it's going to be on the right side. Now, here's a simple explanation. Number one is that the movement of your nerves, they move from the brain and they move down towards your spinal cord and they'll move to the rest of the body. Before these nerves cross the neck, they are moving, the ones on the left are moving on the left side and the ones on the right are moving on the right side. But the moment that they reach your neck, they crisscross, they kind of change. And the ones that were on the left will go on the right side, and the ones that were on the right will go on the left side. The point at which they cross is something we call in medicine as a decussation. So this point is the one that leads to the symptoms in a stroke patient. This is what I mean. If someone has a stroke on the right side, meaning the right side is damaged here, then the symptoms that you will see as a patient on the face is that this side, the right side, is going to become very weak, meaning your muscles on the left side will pull the weak ones on the right side. So the mouth is going to move towards the left side. However, since the stroke is on the right side and these things get to cross, if your hands and feet are affected, your left side is the one that's going to be non-functional. So you get my point? The right side of the face is affected, but the left side of the body is affected. This is what this simply means. And lastly, with strokes, there are certain patients who get to have difficulties with speech. Now, there are two types. There's one where the patient is able to understand you, but they can't speak. And there's another one where the patient is actually not understanding you, but they're able to speak quite all right. So there are two centers in the brain that are very responsible for this. Number one is called the Broca's area. So the Broca's area is responsible for speech production. For you to actually talk, that's your Broca's area that's helping you. But then there's another point in the brain which is called the Wernicke's area. And this one is responsible for speech comprehension, for you to understand something. Some will actually come with no symptoms at all in terms of speech because those areas have not been affected. But if your patient was affected in that particular way, don't get surprised when you see such symptoms happen.